Many candidates fail CASC because they focus entirely on what to ask, but examiners are also assessing how you ask it. Sometimes one sentence can completely change the tone of the station. In this video, I will show you 10 phrases that immediately improve rapport, empathy, and communication. And these phrases work in almost every CASC station. So let's begin. Phrase number 1. I can see this is difficult for you. Simple, empathetic, versatile. Use it when discussing the diagnosis, the risk, family conflict, breaking a bad news. Patients will feel heard when you use this phrase, and examiners will notice the empathy. Phrase 2. Help me understand that a little better. So instead of challenging the patient, become curious. This phrase encourages exploration without confrontation. It is excellent for delusions, complaints, concerns, disagreements. Phrase 3. What concerns you most about this? One of the highest yield CASC questions. Patients rarely tell you their biggest fear spontaneously, and this question uncovers it. Phrase 4. Would it be okay if I asked a few questions about that? This demonstrates respect, particularly useful when you are discussing trauma, self-harm, suicide, substance use. Phrase 5. Many people in your situation experience similar feelings. What does this do? This normalizes the experiences. It reduces the shame, and it is particularly useful in depression, anxiety, adjustment disorders. Phrase 6. Could you tell me what you have understood so far? Candidates often tend to explain too much, but this phrase checks the understanding, and it is invaluable when you are discussing diagnosis, medication, scan results, or treatment plans. Phrase 7. We'll work through this together. Patients want partnership, not lectures, and this phrase conveys support and collaboration. Phrase 8. Let's discuss the options available. Avoid sounding directive. Involve the patients in decision making. And this phrase is particularly useful when you're discussing treatment. Phrase 9. How does that sound to you? This invites feedback from the patients. It demonstrates shared decision making, and examiners love to hear this. Phrase 10. What questions do you have? Don't ask, do you have any questions? Many patients simply say no. Instead, ask, what questions do you have? It assumes questions exist, and this encourages discussion. Let's look at a mini role play and try and understand how we can use these phrases in a logical manner. Imagine the patient says, I'm worried medication will change who I am. The candidate can respond as, I can see this is worrying for you. What concerns you most about taking medication? The patient says, I'll become dependent. The candidate can explore by saying, help me understand that a little better, following which the patient explains and the candidate responds. Many people have similar concerns. Let's discuss the options available. How does that sound to you? Notice how many marks were gained simply through communication. Let's look at some of the common CASC mistakes. Always avoid interrupting the role player, jumping into advice, ignoring emotions, excessive reassurance, and medical jargons. Remember, communication beats memorization every time. So let's look at this ultimate CASC formula. For CASC, remember empathy, exploration, partnership, checking understanding, inviting for questions, all of these carry marks as far as communication is concerned. And if you do these consistently, your scores will surely improve dramatically. You don't need dozens of communication phrases. You need a few excellent ones. Master these 10 phrases and you will immediately sound more confident, more empathetic, and more patient-centered. And that's exactly what CASC examiners are looking for. Thank you for watching and good luck with your CASC preparation. See you in the next video.